Welcome to COIQ, where you learn how health innovators maximize their success. You're working on something big, something life-saving, something world-changing. Yet 95% of health innovations fail, and real lives are on the line. That's why launching is not enough. Commercialization is the most critical, yet overlooked stage of the innovation process. Through candid conversations with health innovators, early adopters, and influencers, you'll learn the 5 components of the COIQ early adoption strategy. So if you want to change lives and dominate your market, why not give your innovation the best chance to succeed? I'm your host, Dr. Roxy, founder of Legacy DNA, an international best-selling author of How Health Innovators Maximize Market Success. And now, let's join the conversation and maximize your success. Welcome back to the show, COIQ listeners. On today's episode, we are going to explore what it takes to successfully commercialize an innovation in healthcare. And I have from someone who is doing it really well. And I have someone with me here today, Julie Mann. Welcome to the show.
Thank you, Dr. Roxy.
So Julie is the Chief Commercial Officer for Hold-On Solutions. And I thought you would be able to, start off the conversation by telling us a little bit about your background and what you do.
Sure. Well, thanks again for having me. So I would say to start off, I am a customer first person, totally. And currently in my role, I lead commercial operations for Hold-On, which is all the customer facing things. So I would classify myself as being the person in charge of making the magic happen, making sure that I'm connecting people that have problems to our solutions that solve them. So I haven't always been in sales. I kind of started my career off in a medical billing company where I used to post charges and payments. And that really served as a really good foundation for kind of where I'm at today.
Yeah.
And so slowly I evolved into different roles. I then started kind of training customers on how to use revenue cycle management software. The sales team then would tap me to kind of help them with sales presentations and demonstrations. And then from there, I kind of got introduced to a full sales role. And I would say the common theme in my career has always been that customer focus, but then also always to work with the most innovative technologies that are on the market. I am by nature curious, and healthcare has tons of problems, and there's a lot of technologies out there, right, that just add to those problems. So I'm attracted to companies that have these kind of breakthrough solutions. And so that's really what landed me at Hold-On today.
So thank you for sharing that. It's amazing how all of those lily pads really early on in our career really influence and build into what we're doing today when we would have never thought that when we were in that moment.
Mm-hmm.
So, you kind of touched on this a little bit. Describe from your perspective what it's like riding this crazy roller coaster of healthcare innovation today.
It's really confusing. I would say that for anybody that's in healthcare that's attended some of the big conferences like HIMSS, for example, right? If you are walking through the trade show floors, right. And
getting gigantic.
It is gigantic, right? And when you just kind of stop and have a casual conversation, right, of being like, so what do you do? It's very seldom that you hear somebody articulate something in the simplest form that you can understand and be like, got it, right? In most cases, especially in those scenarios where HIMSS, has a wide variety of different healthcare technology solutions, not like a niche, audience. It's really interesting, right? So
it's like, bleh, and you're still like, okay, what do you do though?
Yes, yeah.
Right.
Like for me, I've always just really been focused on that is like, how can you take something that's super complicated that is really innovative, but be able to commercialize it in a way that people are instantly going to get it. It's not going to be this really 10 paragraph explanation. It's like a couple sentences, like that's what we do. And then you can dive in deeper.
Yeah. So what are those couple of sentences for you guys?
For us, it's Hold On liberates the data to liberate the care.
I love that.
We love that too. It was like, we do what's really complicated in the back end, right? We have a new way of making data actionable, and we can go into that. But fundamentally, that's what we do. We liberate the data to liberate the care. And it was a statement that my colleague, Robert Conley, kind of just threw out there. We were prepping for a big meeting with our prospect at the time, Phillips.
Yeah.
And he's like, we liberate the data. And I was like, yes, that's exactly what we do. And granted, this was at the time when one of the Star Wars movies was coming out, right? So we're the rebellion, or
Right.
We kind of just loosely kind of put it out there as we were putting our presentation together with Phillips. And when we said we liberate the data, it just really resonated with them, because the current state that we're in with healthcare, right, is data is siloed. It's all over the place. Mm-hmm. People have made tremendous investments in different kinds of technologies, whether it be their EHR, their HIE, their pop health platforms. Yeah. And the fundamental problem that they have is they can't make that data actionable because it's locked in these silos. The best solution that people have come up with is like a portal or something like that, but still not out there. Yeah. So the word liberate, people get it, Mm-hmm. And as soon as we say we liberate the data, they're like, ooh, we need that. And we're like, yes, with a purpose, right? The reason that we're liberating it is we want to let physicians be physicians. We want nurses to be nurses. We want the care team to feel like they have the right information about the patients that they're seeing. And so it's been really rewarding to kind of come to that. It was kind of quirky how it started, but it really speaks to fundamentally what we do.
In my experience, the most powerful, compelling messaging strategy that we've ever developed for our clients has always been developed in the most strangest ways. I have a colleague, and as soon as she says, okay, this is going to sound really dumb, and I'm like, okay, the magic is coming. Yeah. So it's just, you stumble upon these things and it's like, aha. And what I really love about this phrase that you just communicated is obviously it's simplicity. Mm-hmm. But as you think about early adopters, just characteristically of early adopters, they're kind of rebels, right? They're looking for the new, the different, what everybody else isn't doing. Yes. And so just that word, that verb, liberate, what early adopter doesn't want to get behind that movement? Yeah. So I imagine that it's attracting that early segment of the market in a real powerful way.
It really has. And it's allowed us to really kind of cut through, that noise that is HIMSS, that is the healthcare IT space in general. And I think that we're also really focused, right? We're not trying to save the world and do everything, right? The whole reason that we started the company was, we just saw this data problem, right? It used to be a paper problem, now it's a data problem. And you can't just give people a fire hose of longitudinal data and think that that's going to be actionable. And they're going to read through all that text and be like, oh, I just needed to know about who their PCP was, right? So that whole thought of being let's just be really meaningful, being focused on solving this very specific problem, of being able to surface the right information at the right time.
So that's another thing that I think is really fascinating about this whole commercialization process as you're talking about solving a single problem. So a lot of times when we're working with health innovators, they might go into it with the intent to solve one problem, but it's but we could also solve this, and we could solve this, and we could solve this for this market and this for this submarket. And so I find that convolutes the messaging, that convolutes the value proposition. And it sounds like that's also something that you've done that's really been a game changer for you guys, is really focusing on a single business problem.
It really is, because at the end of the day, it's we are so focused on getting the right information to the care team when they need it, right? Yeah. And so it leads to other things, right? So we did go through an exercise really early on when I joined and coming up with our commercial plan, right? Say, who is our ideal customer profile? And not that that's like a unique strategy, but it's really, really important, right? Mm-hmm. And so understanding like, okay, this is kind of what we can do. Who are the people that, have this problem? You could say all of healthcare, right? Like you could say that. We narrowed it down to primary markets, and we were ultra focused on those primary markets. And those primary markets for us are health systems and vendors. And with each of them, they have the same users, right? It's the people in the care, the care teams. And so our messaging is slightly different, right? But we know we have this focus. And we went through this exercise. The first time we did it was really painful, right? Because we have strong personalities. That's what makes us a great team, right? So perspectives, and you kind of work through it.
We do, yep.
Was, we agreed, right? Like this is our foundational kind of game plan. Like this is who our customer is. This is who it's not. This is who we are. And this is who we're not. And it gave us our marching orders so that as we got into these conversations, because it's pretty common, when we're kind of showing people like what we can do, that they'd be like, oh, can you help me with this? And in the past, right, it would have been so easy. We didn't have those guardrails. We'd be like, sure, why not? Let's try it. And it would.
Or we need cash flow.
Exactly.
We need cash flow, so let's do it.
Yes. And so it's also kind of given us that discipline, to say, listen, we agreed on this. Now, every once in a while, right, there will be kind of that anomaly that pops up. But we'll talk about it and be like, okay, like what are the rules that we'll have for this engagement? Let's put some bookends, if you will, around it. Yeah. And because you don't want to shut down something really good. But it's allowed us to have that foundation that we then built upon. And so we knew exactly who we were targeting. We knew exactly what problems we were solving for them. And it just made such a better interaction with those customers.
So, it seems as though that is kind of like a no-brainer, going through the exercise of that targeting strategy and really developing that ideal customer profile. And like you said, not only what you are or who is your ideal customer, but also who is not your ideal customer. Yeah. But so many people overlook that strategy. And what I see happen really often, especially for early stage healthcare tech companies, is that if they don't do that work, when they're in the pilot phase, they get really excited about it and they've got this new business. And typically those early adopter customers are visionaries. They see the future. That's what motivated them to buy into something that was really brand new. And when they do that, they have all these ideas of what they could do with your solution. Yes. And so how do you determine which one of those are going to be great ideas and they're commercially viable for all of your customers, and which ones are just the customization that particular customer is wanting that could derail you and take you off course?
Oh, isn't that a good topic? Well, I can tell you we're going through that with one of our largest ACO customers, right? And they're fantastic. And one of the reasons that they're so fantastic is because we're a perfect fit, right? Like we had a piece of technology that they really needed to solve the problem. And so when you fundamentally have that, right, we didn't force anything, and they didn't force anything. It just was going to work, right? It's like, okay, cool. So we're starting from that standpoint. The other thing that really works is transparency and just talking to them, right? So no doubt they would kind of throw some things at us, and we tried a couple and some just did not work, right? Yeah. And we were like, hey, we tried it. We went into it with you in the spirit of partnership, but this is where we need to stay focused.
Yeah.
And so we just had another conversation, I don't know, I want to say like 3 months ago. And they told us about this really big strategic priority. And we hadn't known about it. And we're like, well, cool, let's help you with that. We're like, we can just, our product does that, right? Like we can help you solve that problem. And they were like, oh, so not only was it such an aha moment for us, like with them, we immediately didn't start, developing everything and, want to commercialize another application.
Yep.
We tapped several industry experts, consultants, analysts, obviously lots of other provider organizations, vendors, and just said, hey, we kind of heard about this. Would this be meaningful to you? And Dr. Roxy, consistently, people were like, if you can solve for that. And so when you get that overwhelming reaction, you're onto something really good.
Yeah.
So we kind of quickly, and again, since we're like a young, nimble company, we can kind of put stuff together pretty quickly. And so we made an announcement about this new application on our platform. And not only did we just make the new announcement, we also found a couple of customers to do it with, which shows you, right? That innovator, early adopter, when they're like, we've been trying to solve this too. You guys have this? Sure. And I think that those are the kinds of markers, if you will, right? That when you kind of are consistently hearing that, you don't just listen to one person, you start to, throw it out there with a diverse pool, and you're getting that consistent feedback. It's so exciting.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation.
So it's almost like an informal version of co-creation with the customers. And so I'm always advocating for co-creation. It's fascinating to me how many entrepreneurs or companies that want to only innovate, do all of that product development with their internal team, and don't tap into the external stakeholders that can really reduce the R&D cost and kind of make sure that you're going to go to market with something that's actually going to solve one of their top priority problems, right?
Yes. And it's funny, even when you say it, it's like, it sounds so obvious.
Right.
You think, like, when you get around technologists, especially, right? Like, some of them get so in love with what they can build, just the power of it. And it's like, no.
Right.
You have to design to solve a problem, and you have to engage those people that you're solving the problem for. And during that process for us, right, like we got super excited, and it was almost like, it's like, okay, let's rein back in, right? Like it's focusing in, and let's talk to people, and not just talk to like, the top executives of our client, but engaging throughout their organization. And multiple stakeholders too. Again, not just talking to one client. And I can tell you, it's so rewarding, right? Like when you actually call people up, right? And I have a lot of favorite clients. My team teases me all the time because they're like, you say that about everybody. But we are the best clients, because if I have a question, I can just call them. And if it doesn't matter if it's like the chief medical officer or, one of the nurses who's an administrator, it's like, they all like want to talk to us because they know that we care,
Well, and that's so, that's unheard of, or not unheard of, but it's rare. Usually it's like, I'm busy. Things are chaotic over here. Don't call me unless there's a fire.
No, and it's so awesome because it's like, it's just making it transparent, right? To be like, hey, we were talking to so-and-so and they thought about this. Would this be meaningful to you? Because if you think about how a lot of decisions are made in healthcare, right? Like, let's just say the C-suite decides that they have this problem and they're like, we're just going to throw this piece of technology at it and it's going to be solved. Meanwhile, the end users get it and are like, we're not using that. And then 3 months later, it's like a bust, right? So for us to kind of engage throughout organizations and be talking to everybody and make sure that everybody's aligned, and then design, the app to meet their workflows and make their workflows better. It's so powerful because then people use it, clinician engagement goes up, ROI goes up, and like everybody's happy. And And that's why I feel like I can say those things. Like, I love all our customers.
So you kind of mentioned this a little bit, but take us back to like the early days, right? The beginnings of Whole On Solutions. What do you think? What were some of those decisions that you or the organization, the other leaders made that you think were just like pivotal decisions for you? Like if you hadn't made that, like you didn't maybe realize it then that it was going to be so impactful, but looking back in hindsight, wow, this was a game changer for us. This was, helped put it set on a path of success.
Yeah, I would say that hands down for us, it was picking the best early customers.
Mm-hmm.
Not only the people who are like the innovators, right? But the people that truly wanted to go into a relationship with us as partners, understanding that we hadn't had everything figured out. We got really smart people that created some like new solutions to old problems, but there was still going to be some figuring out. And, you hear the term like development partners. I don't really categorize them as that. I really categorize them as early customers. And so we had some absolutely fantastic ones, and ones that would work with us and have those conversations, right? Mm-hmm. That I was talking to, not looking to us to be like, they have all the answers. They knew that, okay, here is what we think. What do you think? Let's try it out and let's then talk about it. Like what worked, what didn't work. And I think having those relationships was just absolutely key. And at the same time, we walked away from a few relationships, right? That on paper, it was kind of hard, right? Where we had discussions, right?
Going back to that whole cash flow conversation.
Exactly, right? To be like, that's not going to help us, right? Like, I don't think that that's going to be something that's going to be a long-term win. It is going to help a short-term problem.
Right.
But I really think that fundamentally choosing the best customers was one of the best decisions we've made.
So, kind of take us back to that moment or that stage. Was anyone on the team ever concerned about turning down business or saying that this was an ideal customer and this one wasn't? And, was there any type of, negotiation internally on who those early customers were going to be? Like, I'd imagine that it's not like everybody's always on the same page of like, this is what we're going to do. Some people are, typically of like, how could we say no to this?
I mean, you nailed it. I mean, I think that's what I love about our team, right? Is like, seldom is there any decision that is made that everybody's like, yeah, good idea.
Right.
So it is having those different perspectives and questioning like everything, and I appreciate that so much. And I think that's part of the reason that we've been so successful is because we have that culture, right? Where everybody feels good to be able to kind of jump in and have an opposing view and challenge things because we're all in this together,
Right.
And there were some hard conversations. And I think kind of going back to that ideal customer profile session that we did was like, remember that? Right? That opportunity would be called the sandbox. We want to stay here. And it was helpful, and it's like,
remember why?
Yes. And I think especially when you start talking about like some big names in healthcare, it's like, people just want to have that as a customer. And it's like, yeah, but you guys, it's not a good deal for us, right?
Oh my goodness. It's like you're preaching to the choir here. Like, don't get all woo-woo because, ABC Oompty Oomp Health System said yes. They could actually be your demise.
Yes.
They could take your company down.
Yes. Totally.
The bureaucracy, the time, the change of priorities, and a lot of times, especially for startup or emergent companies, I'm often recommending that they're looking for the, C level of clients, right? Not even the secondary ones, but C-level, because I found that they're going to be the ones that are more open to that partnership relationship that you described earlier, where they're not expecting you to have all the answers and they're really wanting to participate in the development of that solution.
Yes. Yep. And I can totally see that. And I think that, when we look back at these things, that's everything, right? Those early relationships and growing them into even bigger engagements is really, really exciting. And we've certainly experienced that with our, vendor partners, because it's real to them, right? Like they're in a competitive space. They have users that want their stuff to be easier to interact with. And so Hold On can be their silent partner. So it makes sense, right? That we're constantly at the table with them and talking with them. And there's some really cool things that are going to come out of that.
Yeah, that's awesome. So, there's a lot of conversation right now about not necessarily going to market with products and solutions as much as it is with going to market and creating a category. And letting the market catch up, and that being a really a real strong strategy for success. And that if you're just looking to just build awareness and adoption of your innovation, you're only going to increase, so far. But if you're actually trying to help create a whole category that, so much thought leadership and authority with that it kind of snowballs its effectiveness. Any, experience or thoughts around creating a category versus marketing a specific solution?
It's so interesting that you say that, because when we were really kind of coming up with our foundational messaging a couple of years ago, it was hard for people because we are a new solution, right? We don't fit into any one category nicely, right? Right. Because we are surfacing insights into the workflow. We're not an interface vendor. We're not in analytics. We're not in EHR. And at first, people just want to bucket you into one of these categories. And so we went through this discussion of like, okay, maybe we're this new category. And then we're like, let's not do that. Let's just focus on the problem that we're solving, right? Yep. And kind of stay there. And kind of fast forward, to just even a couple of weeks ago, I was talking to, I had a series of talking to several analysts. And I talked to Forrester, Gartner, and Frost & Sullivan. Yeah. And in every single one of those conversations, Dr. Roxy, they were like, you guys don't fit into any one category. And they're like, we love this. Right. Most useful stuff doesn't. And I was like, oh, cool. Because we think that too. I stopped stressing out about it, Right. And just being like, does not apply. I can't tell you how many forms we would fill out where they're like, what category do you fit into? And I was like, does not apply. We're great, right? Because we don't, but we're solving a problem.
Right, right. That's so funny. So, that in my experience, it's one of the pitfalls because, it's a natural in a lot of ways for us to want to fit in one of those boxes. But then there becomes this disconnect of how are we going out into the marketplace and saying we're unique and different. Right. We're wanting to attract these revolutionary early adopters, but we're like this. Yep. It's like, well, now you just basically, ruined everything else you were saying because now all of a sudden I'm putting you in the old box and you're not exciting and new and different anymore.
Yep. Yeah. And I love that you say that because, again, that was another one of those kind of decisions, right? Where it was like a lot of stress. And I'd be like, maybe I'm thinking about this wrong, But we're like, you know what? No, we're just going to lead with this, right? We're not going to spend all this time creating this category or whatever, right?
Right.
We're just focused on what the clients need to be successful. And I'm so happy that you said that.
So what number employee were you? Because I think you were one of the earlier, or you were there, in some of the beginning stages, right?
Yeah. So hold on. The solution that we have today, we just commercially launched it in January of 2018. And I say that I'm like, oh my gosh, that was like in so many ways, it seems like yesterday. And then it seems like many years. In the
Right.
And so with that, I was part of the team, right, that was brought in to commercialize, the solution, which is awesome and exciting. And so very early on, we are in growth mode right now, and we are going to be, expanding our team, which is really, really exciting. And so I think it's been really rewarding to be an early member of the team and kind of go through kind of that stage and just know that there's so many other great things ahead of us.
Well, one of the things that I wanted to point out is that you're the chief commercial officer. And that is a title that I often find in much larger, mature organizations. So I think that as someone being on the outside looking in, I would say that that's probably one of the most important decisions that the CEO or the leader, whoever hired you, made, was bringing someone of your caliber to kind of fulfill that role that early. I don't see that happen very often. They're thinking like, oh, well, when we get to this, that's when we'll bring someone at that level in. But at that point, all of those commercialization decisions are mostly already made. And so bringing you in early, I would assume had a big impact on the business.
I think so, and I think like it was very clear to the team, they told me that they knew exactly kind of what they were getting with me, right? So they were really focused on kind of picking me because they felt like I could kind of help them out. And I had that walking into it, so I knew that I had the confidence of the whole team and that everybody was going to be very open, collaborative, and honest with me. And I can also tell you that when I first started, they kind of thought I would just be over sales and helping kind of commercialize from that perspective. But very quickly it changed. And very quickly, I think like 3 months, right? It was like
no, there's all this value we can't pass up.
Right. And it's almost like when you're early stage of that, right, too. From me, I wouldn't have been able to do it if I was super siloed. I needed to be able to interact with all the client facing components of the business, right? Because going to clients and listening to them, and then, talking to prospects that have problems, and then talking to our implementation team, or, all of those things allowed me to kind of lead our strategy as a member of the team. But it's been very rewarding, and I couldn't be happier.
So how do you, how do you think that the early structure of the organization and culture of the organization is playing a role in your success?
I think that it is critical to our success. I think that the culture at Hold On truly is, it's a team effort. No one thinks that it's, one person driving everything. And I feel like kind of having that culture of we're all in this together, and also this openness, right? Of everything's not always rainbows and unicorns.
No.
It's good to kind of constantly be bringing feedback back and talk through those things. And I think that culture is so special. And we've tried to also kind of put that out there because a lot of companies don't kind of have that. And, it's awesome with all the tools available today, right? Like we're huge on Twitter, we love LinkedIn, we do blogs, and we try to post pictures of different things, like outside of just the professional stuff that Hold On's doing, some fun stuff.
Yeah.
And it's so cool because I'm always talking to a prospect, and I wrote a blog about the Revolutionary War, and I used the term liberate, and she was like, I was reading that and I was wondering how you're going to tie that back to liberating data. She goes, but I loved it. And it just set the stage for such a nice conversation, right? Because she felt like she already knew me a little bit, and she already knew like, the vibe at Hold On and what we were trying to do. And she's like, listen, this is where we're at. And it was like we were already on the partnership discussion.
Sure.
Over that getting to know each other thing a little bit more. And so I think as we grow, we've been very intentional to try to keep that, spirit out there so that people can kind of see, hey, this is what Hold On's all about. There's no surprises. And I think that's really important.
Yeah, that's awesome. I'm so happy for you guys. So you just kind of touched on something else that I think is really interesting, is the power and the equalizer of social media. So, that idea is not necessarily new, right? Social media has been around for a long time, but I think especially in healthcare and for a startup, again, that whole social media thing is kind of like, okay, when we get to a certain size, then we'll hire someone to kind of manage our social media media. So it's kind of like a afterthought or like a longer term strategy. And there's such a huge opportunity that's missed if we overlook that or wait for that for later, for all the reasons that you're just talking about. When you're talking about boots on the ground and trying to connect with people, right, with phone calls or emails or knocking on doors, it can, especially with a cold prospect, I mean, oh my gosh, it can take forever. But then you can have that encounter, that unsolicited encounter on digital, and just open the door wide open.
Yeah. And you know what? I feel like so many healthcare companies aren't doing it. You know, I've been a fan of it forever. I had a friend, Gabe. He's amazing. He set me up on this like maybe 5 years ago. I kid you not. He called me the other day. It was like, I love what you're doing. I'm always following you on Twitter. And I said, I know, it's so powerful. And that's what I love about it is you can pull like the topics that are important to you, and you can kind of cut through the noise. And so for Hold On, that's been a big deal. You know, we do hashtag liberate the data, and boom, you get all our stuff. And it's like, you know, it's fun to put it out there, but we've made some really, really great connections. You know, I got introduced to this woman by the name Janae Sharp, and she does the Sharp Index, which is dedicated to reducing physician burnout, which is such a great ally for Hold On, right? So it brought us together, and we've done really cool things, and we have a couple other things planned, but we've met so many people like that through the use of social media, and it's almost like a modern day, like newsletter, you know, think about like, you know, back in the day, you would mail out, you know, like a slick to somebody and whatever. How do you do that today? Those ends up in the garbage can, you know, with Twitter.
And we don't have to have their email address.
Yes, exactly. And it's exponential. And you can also like, it's just really cool. And it's a way to engage with people and in the market and, just stay current on what's going on.
So what recommendations or advice do you have for those listeners, those health innovators right now that are in the trenches that are really struggling for one reason or another? You know, what recommendations do you have for them?
I would best sum it up probably by a lot of the topics, you know, that we touched on. I would say you've got to start and you have to be focused, right? So you got to really have a problem that you're solving. If you're not solving a meaningful problem, like forget about it, just stop. Right? So assuming you have a really great problem, or I should say, you have a tough problem, you have a really great solution to that problem. You got to go through that rigor of identifying who your ideal customer is, right? And then you have to stay disciplined with focusing on that. And I think once you kind of have those things, the rest will kind of fall into place, you know, and having those early customers, right, that are going to look at you as a true partner and you're in it together and you're getting feedback and support from them. I think that those things combined are really what struggling organizations should look at first.
Awesome. Well, thank you so much for sharing your wisdom today with all of our listeners and with me. I appreciate it. It's been great.
Thank you so much. This has been so fun.
Absolutely. All right. Well, until next time.
Okay, bye.
Bye.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.